Hello friends. So today in this class we are going to discuss the various patient positions. Why is patient position an important topic? Because for various surgeries, for various procedures, we need the patient to lie down in different positions. Now why the patient is required to be placed in that position, that we will discuss, and we will discuss which position is used for which procedure. Okay, so we'll go straight to our topic. So as you can see, the first is the usual supine position, that is the patient is lying on the bed on his back and the chest is facing forward and with everything in extended position. Okay, so this is your usual supine position. What is it used for? It is used as a general comfort position, and it is used in most of the surgeries or procedures. So what you have to remember is procedural or surgical. This is the most common position, that is C. Okay. Coming to the next one. This is Sims position. So you can see in the first figure is the posterior view, and in the next figure you can see the anterior view of it. And can you see how the legs have been placed? So the leg which is placed upwards is slightly flexed, and you can see the knee facing forward. So this is the Sims position. Now you can see that if a patient is lying in this position, the pelvic area is exposed. So what happens is, where can it be used? It can be used for administering enema. It can be used for perineal examinations. And what is the other thing that it is used in? If you if there is a pregnant female and you ask her to sit and lie down in this position, it just gives her more comfort. Okay, so this you have to remember. Coming on to the next position, this is the prone position. This is opposite of your supine position. So where is prone position used? So how is the patient lying in a prone position? He is lying on his stomach. Okay. So now the mouth is facing downwards. So where will it be used? It will be used in for drainage of mouth after neck or oral surgeries. You've had a surgery here, you had a surgery here in oral area. So when you need a drainage of mouth, you use this position. Now, what is another most common reason where we have seen that the patient has been asked to lie in prone position? So very recently we were hit by a pandemic called as COVID, and if you had been posted in the COVID duties, you must have seen that there was a chart for pronation of the patient. So what did that chart contain? A chart contained that for how many hours the patient has to be in prone position, and then for how many hours the patient has to be in the supine position. So what was the prone position doing? So you know that if the patient is lying supine, then there will be some pressure on the lungs. But if the patient is lying in the prone position, the lungs will be forced towards the bed and their expansion will be easier. So what it did was, it used to increase the oxygen saturation. So your prone position helps in increasing oxygen saturation. This is a very important question that you have to remember. Right? Coming on to the next position. The next position is our knee chest. Now there are two different figures. So how do you know what is what? This is your prone knee chest. And what is this? This is your lateral knee chest. So both have different uses. Now in your prone knee chest, see, you can see the knees are lying down here on the bed, and at the same position is your chest. Okay, and the knees are drawn towards the chest. So this makes up your knee chest position in a prone way. Prone way. Okay, so where it is used in the pregnant females, where you have seen that there is fetal malposition or there is an umbilical prolapse. In both of them, this is used. What is the golden question for this patient positioning topic. In the patients of TOF, whenever they are having a TOF spell, please remember this. In TOF spell, the patient is asked to lie down like this, in this prone knee chest position, because it helps in expansion of the expansion of your chest cavity, and it helps the patient to breathe. So TOF is in TOF. This position is particularly used. So this is a question that you can get as a direct question, that the patient has to be placed in which position if the patient is suffering from a TOF spell. Okay, so TOF spell. Now, this knee chest position, the lateral one, you have seen in the wards a lot of times. Why? Because whenever a lumbar puncture is being performed, the patient is asked to lie down in a knee chest position. What does it do? It increases the intervertebral space and it facilitates the procedure of lumbar puncture. Okay. So now if it is facilitating your lumbar puncture, what else is it going to facilitate in? The spine surgery. So very easy to remember. You see what position it is, and you know when the patient is curved against from the behind, uh, the intervertebral space will be easier to find out. So it will be used in these two cases. What is the next position? Let's see. Our next position is the lithotomy position. Again, lithotomy position is very common. Where have you seen it? You've seen it in the labor rooms. So what happens in this? The patient lies down on her back, and the legs are made to be tied through a stirrup. Okay. So what happens is, the pelvic area again is exposed. Now pelvic area is exposed. So I told you that the most common place where you can see is the labor room. So childbirth is the most common place where you have to have the patient in lithotomy position. What are the other procedures? Again, certain gynecological procedures or surgeries, and in the pelvic surgeries, you are going to place the patient in this position. Right? Now coming to the next. This is your Fowler's position. Now Fowler's position are of three types. It can be high Fowler, it can be semi-Fowler, or it can be Fowler. Right? So why high Fowler, semi-Fowler and Fowler? So all of them have different uses, but how would you identify? So can you see the angle here? You can see the angle here. So right now this patient is in Fowler position. Okay. How do you know? When the angle is 60 degrees to 90 degrees, when the angle is 60 degrees to 90 degrees, it is high Fowler. For semi-Fowler, it is 30 to 60 degrees. And for 15 to 30 degrees, it is your usual Fowler's, right? So this is your Fowler's position. If it is slightly highly raised, it is semi-Fowler's. And if the patient is lying in the right angles, then it is your high Fowler. So where is high Fowler used? High Fowler is used for your nasogastric tube insertion. You ask the patient to lie erect, and the nasogastric tube can be inserted in that position. Now, in semi-Fowlers, where is the semi-Fowlers going to be used? In a lot of cardiac surgeries that you have. So, post-cardiac surgery, the patient is asked to lie in semi-Fowler position. And your general Fowler position is for general comfort, like like your patient is pregnant. So if you are placing her in normal Fowler position, she will have comfort. If the patient has any kind of respiratory distress, if the patient has had any cardiac issues, if you lie the patient in the usual fowler position, then the patient is going to have a little bit of comfort for which the patient is placed in fowler's position. Okay. Now next is your orthopenic position. Orthopenic. Orthopenic position again helps in better respiration. So what happens is, see, if you have any cardiac pathology like pericarditis, you're having pericarditis, so there will be fluid collection around the in your cardiac cavity or around it. So what happens is there will be pressure on the lungs, and subsequently you will not be able to breathe properly. So if the patient is made to sit in this position, the lungs get a better position, a better chance to expand, therefore facilitating the breathing. Okay, so pericarditis, COPD. Now what is thoracocentesis? Thoracocentesis is when you are removing fluid from your thoracic cavity. So for that, this is the position that you prefer. Okay. Coming to next position, this is your lateral position. Now lateral position can be right or left. So for right lateral position, where it is used post-operatively in a liver biopsy, or it is used for promoting gastric emptying. This you have to remember. Okay. And for left, again, pregnant females, just to give them a sense of comfort. Okay. So pregnant females you have to remember. Coming on to next position. This is your Trendelenburg's position. You can see that here the head end is lowered than the position of the feet. Okay, so the head end is lowered. What does it do? It increases your venous return. So any condition where you want your venous return to be increased, you have to place the patient in Trendelenburg's position. Okay, so what is the most common reason? It is hypertension. In any kind of surgeries also, if at all the patient is getting hypertensive, so we try to put the patient in the Trendelenburg position. Whereas the other example of putting the patient on Trendelenburg position is here when after a blood donation, suppose the patient faints or the patient is having a vasovagal reaction. At that point also the donor is put in the Trendelenburg position, so the venous return increases and there is more blood supply to the brain, so that the patient comes out of that vasovagal spell. Okay, so first is hypertension. What is the other? Your patient is pregnant and she is having umbilical cord prolapse. In that case, you are going to place the patient in Trendelenburg's position. And the last one is for placement or removal of central line. This you have to remember. For placement or removal of central line, you have to keep the patient in Trendelenburg's position. Now, once we have read the Trendelenburg's position, the next we see is the reverse Trendelenburg's. In reverse Trendelenburg's, where do we see? Now here what it does is, it prevents pulmonary aspiration, it prevents reflux, anything that is going upwards you have to prevent. If you have to prevent something from going upwards, you are going to put the patient on reverse Trendelenburg's position. So for prevention of pulmonary aspiration, for preventing reflux, and as it is more towards the gravity, it is going to promote gastric emptying. Okay, so coming to the next position. Now here you can see this is the kidney position. So here you can see that the patient otherwise is lying in the lateral position itself. Now since it is used in kidney surgeries, we want to expose the kidney here. Okay, so that is why there is an abdominal tilt here in the middle. So where are you going? So how are you going to place the patient? It will be on the contralateral side. So whichever kidney you have to operate on, the contralateral side, the patient will be placed on in the kidney position, and not just like this, there will also be a stand behind on which the patient's back would be lying. Okay, so he's in a lateral position with the back resting on a certain support, and here the kidney will be exposed for surgery, right? Now last is your jackknife position. Jackknife position. There is another name for jackknife position. It is called Kraske. Krask position, right? This you have to remember. If the photo is not given, if the jackknife position is not given, this is the name that you are going to search for. And very simple, it is used for colorectal procedure. Just one single thing that you have to remember about this, you can see there is again an abdominal tilt, but the patient is lying in a prone position. So if the patient is lying in a prone position and there is an abdominal tilt, it is the jackknife position. And if the patient is lying in the abdominal, in the lateral position and there is an abdominal tilt, it is the kidney position. So I've told you about all the kinds of patient positioning which is there and in what procedures or surgeries it is used. Thank you.